You're welcome. This is your friend, not solution. So tonight, let's talk about erectile dysfunction. Talking about erectile dysfunction, we have various sexual dysfunction, both in men and women. And when we're talking about erectile dysfunction, is a male problem. Do you understand? And when we're talking about erectile dysfunction, let's just say, what is erectile dysfunction, right? Erectile dysfunction is just a sexual dysfunction whereby the man is not able to have an erection or thereafter is not able to sustain the erection. You understand? Stronger enough for sexual intimacy. Then, when we're talking about erectile dysfunction, it could happen to anyone. It is, according to research, it is believed that some men at some point in their lifetime will go through erectile dysfunction. And most of them, there are always a solution for most of the causes. So we'll be diving into what are the causes of erectile dysfunction. The number one cause of erectile dysfunction is physical causes. And when we're talking about physical causes, it can be related to heart diseases. And we have various types of heart diseases. And for you to have a normal sexual function, there must be something we call, there must be like blood flow to your male organ. But when you are having heart diseases, the proper blood flow, there might not be proper blood flow. And what happens? Your male organ begins to suffer for it. So heart disease is one of the causes under the physical causes. Then, of course, we have high cholesterol. That's cholesterol in our body. We have two main types of cholesterol. We have the good cholesterol. We have the bad cholesterol. One is HDL. The other is LDL. When you have high cholesterol, it might affect your libido. It might affect the way you have sex. It might affect it. It's one of the causes of erectile dysfunction. And apart from that, it can be as a result of high blood pressure. When you have high blood pressure, like your male organ cannot function properly without adequate blood flow. So when there are heart diseases or high blood pressure is still heart related. It might give you issues with erectile dysfunction. All right. It might give you issues with sexual function. And of course, it might be as a result of diabetes mellitus, that is high blood sugar. If you have high blood sugar, you might experience what we call erectile dysfunction. And we've said erectile dysfunction is when you are not able to achieve an erection, or the erection might not be strong enough for sexual intimacy. And it might be as a result of obesity. When you are too fat, there's something we call basal metabolic index. When you do that test, if you are not able to do it yourself, you can talk to your health care professional. So they'll be able to know, are you obese? Are you do you have the normal? Because it's categorized in three places: mild, moderate, and severe obesity. So if you have just normal obesity, or you have morbid obesity, depending on the type of obesity you have, you might have issue with your sexual function. And of course, it can be something we call clogged, when your heart, hi, good evening, you're welcome. Clogged blood vessels, we call it arteriosclerosis. When the vessels of your heart that is like straw that is supposed to be, allowing your blood flow to go up and down, this time around, they are not able to allow, because there is accumulation of maybe fat, plaque inside the walls of your heart, the place that carries blood to and fro for oxygenation. Oh, thank you. So, and what happens at the end of the day? You might not be able to have an erection, talk less of having sexual intimacy. And of course, there can be as a result of tobacco use. Most men use tobacco. And you know, these days, it's not only when you smoke, we have cigar, we have some people vape. Even if you vape, there are some ingredients that is being added to those things that we use in vaping that is related to the ingredients or the materials used for cigarettes, so, the normal cigarette. And what happened? It affects because it will not allow blood to flow into your male organ. And what happens? You are not able to have an erection or sustain an erection to be able to meet with your partner. It can be as a result of some effect of some medications. Like if you there's some hypertensive drugs that if you are giving hypertensive drugs, what happens? One of the effects is loss of libido. One of the effects is erectile dysfunction. So in those areas, if you see something like that, it is appropriate to just talk to your healthcare provider to let them know that this is what I've been going through. It is not enough to keep quiet, because I've always said on this platform, seeking help in whatever you are going through. Maybe you are tending towards depression, you are anxious, you're having an overwhelming stress or burnout. It is better to seek help. You understand? If you don't have any close person you can talk to, you are sure your medical your medical personnel or healthcare professionals will always be there for you, no matter how bad it is. It can be as a result of diabetes mellitus drug. If you have high blood sugar, there's some drugs that doctors can give you, and of course the drugs can lead you to losing your libido, or of course allowing you to have erectile dysfunction. Then apart from that, it can be excessive use of alcohol. You understand? Because all these things, most of them are not natural, especially when you are talking about the higher percentage of alcohol. You understand? We have the 2% volume, we have 1%, we have 7. Some drinks are up to 15% alcohol, even the so-called wine. So when you're taking alcohol in excess, you don't have you don't have boundaries. You don't know this is how much of alcohol I should take. This is how much of smoke that I should take. What you are telling your system is that your blood that is supposed to go to your male organ for you to be able to have an erection will not be able to go there. Will not be able to go there. So what happens? You can come down with either loss of libido or erectile dysfunction. You understand? It can be as a result of low testosterone. There is a particular hormone in male, we call it the male sex hormone, just like the women too have their own. And this is what we call testosterone, low T. Some people say T. So if there is low testosterone in your system as a man, since it's the male sex hormone, you might not be able to do what? To have an erection or even have adequate sex life, because it's like a catalyst. The male sex hormone is like a catalyst, the testosterone. So if it is low or reduced or is becoming declined in your system as a man, you might not be able to sustain or even have an erection, talk less of sustaining the erection. And of course, it can be as a result of stress, like you don't have enough sleep. It is recommended in a night that you have maybe minimum of 7 to 9 hours of sleep. And if you're not able to get minimum of 7 to 9 hours of sleep, or you are anxious, or you're going through stress, or you have a burnout or something, it might result in erectile dysfunction. And of course, it can be as a result of mental health issues. If you have mental health issues, it might be depression. You understand? And when we're talking about depression, it has a whole lot of signs. So we are still going to be discussing depression. What is depression? We'll be talking about that. So it might be depression. We said mental health issues. And onto that mental health, we can categorize our stress. We all go through stress. Just that the way you're going through your own stress is different from the way I'm going through my own sex. And apart from that, the way I'm able to resolve my own crisis when I'm going through stress might not be the same way you are resolving your own crisis. You understand? So, but after all, stress is stress. It can be as a result of anxiety. You are anxious. Maybe you have an issue that you are not able to resolve on time. You are becoming anxious. You are becoming afraid. You are jittery. You are jittery. You are not happy. You are just you're almost going into panic attacks, or you are already in panic attack mode. All those things are some of the things that cause erectile dysfunction. Of course, it can be as a result of relationship issues. It can be as a result of relationship. You have maybe a trust in your relationship has been eroded or is being eroded. It can lead to loss of interest, and you will not be able to have an erection. It can be that there is lack of communication in your relationship. Of course, when there is lack of communication or the crisis, your mind will not even go towards that area at all. Apart from that, it might be as a result of cheating in your relationship, and the relationship is broken into pieces, and fixing it is now becoming an issue. If it's becoming an issue, what happens? There is a crisis. There is a big crisis if it's becoming an issue. So you still have to keep moving. No matter what, you still have to keep moving. And of course, it can be stress, it can be burnout, it can be work related stress, it can be financially related, it can be relationship related stress. And if it is not properly managed, it can lead you to erectile dysfunction. And apart from that, it can be as a result of aging. You understand? It's like the way the women enter menopause. You understand? Men too, they have their own, which is called andropause. That is the stoppage of androgen. Our own, the stoppage of menopause. So when you have the stoppage of androgens in your system, what happens? There is a crisis. There is a crisis. And you might not be able to have an erection, talk less of, sustaining the erection. So, like I said, it might be due to some medical condition, like heart diseases, like it can be as a result of diabetes mellitus. It can be as a result of high blood pressure. It can be as a result of multiple myeloma, multiple sclerosis. A whole lot of things that could lead to erectile dysfunction. And when we're talking about erectile dysfunction, it is what are the symptoms? Let's talk about the symptoms. One of the symptoms, the first symptom, it has just three symptoms. The first symptoms is trouble getting an erection. Trouble getting an erection is the first symptom. That's the first symptom. You notice that you are not able to, get an erection. It's not that you are stressed up. It's not that you are not being able to sleep. You understand? You're having a burnout, a stressful day, or relationship issue, trust issues, infidelity, or something like that. You just notice that you have trouble getting an erection. That is the first symptom of erectile dysfunction. And now, if you are able to just get it and it's not being sustainable, you can't sustain an erection. It is a problem. Because if you cannot sustain an erection, there will be no action thereafter. It can be, that you cannot sustain it, you can't keep it. And of course, you lose interest in sex, not wanting sex at all. That is loss of sexual drive or sexual libido. Those are some, or those are just the things that we see when we're talking about erectile dysfunction. And talking about erectile dysfunction, what are the complications of erectile dysfunction. Number one complication can lead to poor sex drive. You don't want to even go there at all. It will lead to poor sex life, and your partner might not be happy with what is happening, and you be like, oh, I cannot do this. I'm tired of this. I cannot cope with this. You understand? That is number one. Number two, it can lead you to low self-esteem. You understand? You begin to see yourself as no good. No, no. It can lead you to low self-esteem, right? And of course, it can lead to depression. It can lead to depression. And when you have depression, depression has a lot of signs and symptoms. At times you are gloomy, you are moody. It's some people have depression, they don't want to bath, they don't want to eat, they don't want to talk to anybody. It has a whole lot of symptoms. It can lead you to depression because you have been in the knowing. You are a go-getter. Things are working and you are seeing everything. And you are seeing everything. So, and when it is like that, it gets to a stage, you get tired. When you get tired, what happens? You get depressed. And of course, it can lead you to anxiety. You are anxious. Hey, hey, what is happening? You don't know what is happening, but you are anxious. What do I need to do? What can I do? And you start getting anxious. It can lead to relationship issues. You understand? That's the need. That's the reason when we'll be talking about the ways our communication should be the first thing, the very first thing when it comes to, ways out of erectile dysfunction. It can lead you to anxiety. It can lead you to relationship issues. It can lead you to low self-esteem. You don't believe yourself again. You don't believe in yourself that you can do it. Embarrassment. You are embarrassed. You are embarrassed. Then, of course, you might not be able to impregnate your woman if you have erectile dysfunction because you are not having an erection. You can't sustain an erection. And you are having loss of libido or low sexual drive. So there is no how pregnancy will come. So those are some of the complications. Then when we now want to talk about how can you get out of erectile dysfunction, it is not palatable for a man, a man that's been used to having regular sexual intimacy with his partner and is not able to. You understand? It leads to relationship issues. You understand? And the partner might decide to start looking elsewhere for pleasure and comfort. So when we're now talking about erectile dysfunction, it can happen to anybody. Not that because I'm young, it can happen to young, the young adults, maybe from 20. Some it can happen to anybody, but it's very common in older men. As you continue to age, there's something we call degenerative disease, the changes or degenerative diseases, as because of continuous wear and tear. You understand? Or the body of your sexual organ of the whole system. What happens? You begin to feel less useful, less the strength, the tensile strength begin to reduce because of what we call the law of diminishing returns. The body is now taking its toll. You can go 5 rounds, go 10 rounds, go 20 rounds, but this time around, there is nothing. The strength is not even there. The capability is gone. So when we're talking about ways out of erectile dysfunction, the first thing you want to do is communication. As soon as it is noticeable, you understand? Of course, before you can notice that, maybe you were already, a planning or something to make out with your partner. and you notice things. That is the first thing. You can't have an erection. You can't keep an erection. What happened? The next is that you lose interest in having sexual intercourse and intimacy with your partner. So the ways out, the first thing you want to do is communication with your partner. If your partner is in the knowing, it becomes so easy for the both of you to be able to work it out. But if you are hiding it from your partner might see that maybe you are abandoning or neglecting. They might see it as a form of neglect or a form of sexual abuse that you are trying to play on them. So the best thing, the moment you notice, if it's the first time, you might just look over it. But if it's getting out, you want to make out with your partner, then tomorrow, next tomorrow, and you feel that it is time to communicate. You understand? Most of the times, if you don't hide yourself, if your partner might have one or two things that they can do to help you pull through. So after that communication, what you want to do before you see your health personnel or medical personnel or something is going to be the last resort. You understand? We have a whole lot of things, activities that you can put in place to help you pull through erectile dysfunction. So when all others failed, then you're able to retract back to the last resort, which is your medical personnel. It is recommended by the World Health Organization that you need, even with or without erectile dysfunction, that we all need minimum of 30 minutes of exercise per day. That means about 180 per week. Then if you're not able to do like every day, you can do every other day to keep you going. When you are able to do good exercising, there's exercises like we call some exercises cardio exercises. They are just like brisk walking, like swimming, jogging, riding bicycles or something like that. So when you are able to do, it keeps the muscle of your penis, stronger. And not only that, it helps you. Apart from that, it also helps you with adequate blood flow to your male organ, thereby, helping you to be fit in the other room, in the bedroom with your partner. So there won't be any boring moment. It will be, fun, 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 fun all the way. Another one that you want to do is you should stop smoking. Not to reduce smoking, because smoking has a serious effect on our reproductive system. You understand? It has serious. All those chemicals, the chemical that is used for cigarettes or smokes, or even the one they put in vaping, has a lot of things that might, that might not be funny, that might, prevent you from enjoying your sexual life. So you have to stop smoking. There's nothing like reduce smoking when we're talking about erectile dysfunction. You just have to quit. And if you need help, you have to see your medical personnel. Seeking help is not something. See a doctor. If you need help to quit, the addiction is addiction. It can be addiction to sex, it can be to water, it can be to food, it can be to spending money, it can be to friendship, it can be to traveling. Addiction can be anything. And it takes, help. You understand? Ready to seek help. You understand? You realize that you have a problem. That's the first stage. Then you are ready to seek help. And when you seek the help, you are ready to abide by the rules and the dictates of the person you are seeking help for. You understand? So addiction is addiction no matter what. So you have to break that habit of smoking. It has to be broken. It has to go. You want to overcome erectile dysfunction. And of course, you should reduce excessive consumption of alcohol too. Alcohol too has effect on your sexual health. So if alcohol has effect on your sexual health, why not cut it down? If you cannot quit, you can cut it down. You can cut it down. Do you understand? And apart from that, there should be regular checkup. Checkup is very, very important. You have to check up with your doctor if there are anything. If you have mental health issues that you think might be the reason for you having erectile dysfunction, you have to seek help. And there's a pause, there's a technique that is done for people that are going through that. We call it the pause technique. You understand? You can also engage yourself in that. And of course, if there are any underlying condition, like let's say diabetes or heart diseases or hypertension or something, you should be able to see your doctor, your medical doctor, so that if those underlying conditions are being taken care of, what happens? You'll be a free man, a free woman, a free man, and your partner will be able to enjoy you, and both of you will be able to enjoy yourself. So you have to continue to seek help, seek help, seek help. And we have various medications now that can be used, you understand, for erectile dysfunction. But I bet you it is better and appropriate for you to do what? Consult with your doctor before you take any medication. Especially in this part of the world, you hear people, you just add from one person or the other that they are using this particular drug for hypertension. They won't bother to go see their own doctors again. What will they do? Straight to go and pick the drug and go and buy and start using for their own hypertension. Oh, somebody says, oh, I've been using this medication for diabetes and it's working wonders. My doctor recommended it. They will just go and buy. A visit to the doctor is cancelled. You understand? Somebody says, oh, this is the drug I use for my erectile dysfunction. You don't even know whether your heart is good. You don't know whether you have any underlying issues. But because we all have this feeling of self-awareness, because we want to do satisfy our partners and just go straight to the chemist or the pharmacy to go get drugs for treating erectile dysfunction. Oh, no, 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 no. It's not going to work. It can lead to your hand. It can kill you. It can kill you. It might be the last. You might not live to tell the story.